live. Morning, Richard Buckley, MilfordMD. We've been busy. We didn't film for a while, so I thought we'd film something this morning. Working on a patient's back today, and the lower axillary bra bulges, the bra bulges here, and the waist and hip bulges here. This area is a zone of adherence, so the skin is kind of tethered down, and then whatever's above it likes to roll over on top of it. And so today we're going to smooth all that out. I'm doing vasering right now, which bounces fat cells off of wherever they're stuck. And then I'm going to go around and liposuction the fat cells that we've bounced off of where they're stuck. I'm going to liposuction them out, do some contouring. Our patient also has a little bit of scoliosis, as many people do, so a little bit of curvature of the back. This side is actually quite a bit different from this side as far as how the fat lays out and what I need to do. It's always something to keep in mind, whether or not people are perfectly straight, asymmetrical, one shoulder's down, one shoulder's up, etc. Later this week, we'll bring our patient back. We'll work on her front side and do lipo-sculpting, vasering, and also make a new belly button for her. You know, some people, for various reasons, might not have a belly button, and so we can make a new one, a neo-umbilicus. And so that's what we're going to do on Thursday. Today's Monday, the 17th of February, 2025. So if you want to check us out on Thursday, I'll do some live with that so you can see how that goes. It's pretty fancy. So vaser followed by liposuction. We use all different kinds of gadgets to do liposuction with. I mean, first of all, you need some kind of suction. Today we're using the suction device that is part of our vaser gadgetry. Sometimes we use a Klein suction pump, Byron, we use different things. And then we have different tools that we pop under the skin to suck the fat out with. They have holes in them, which is where the fat goes to be sucked out. And the holes have different configurations. Some have, you know, some holes towards the end of the little cannula. Some have holes that are cylindrical. This is one here which is actually a little bit rough on the surface. I don't use that one very often. Let's grab another one for show and tell. This one's called a finesse, invented by Jeff Klein. Dr. Klein, who invented tumescent anesthesia, but that's a finesse. And I put those holes when I use this cannula down. It's got a little flat part, so that tells me the holes are down. And that allows me to sculpt and not remove anything from directly under the skin, but rather lower down. So anyway, they're just all different kinds of paintbrushes to do the artwork with. Nothing that patients need to be concerned about, but it's of interest to me with paintbrushes I have. And after we do this vasering, then we'll get the fat out of here. So it's a two-step process. You're wondering what these are. Yeah, those are little ports, they're called. It's almost like a little golf tee, and that keeps the fluids in there from leaking out. On this one over here where I'm working, there's fat that's just coming out of here. That's liquefied fat that's coming out. The reason for these little, plastic things is to protect the skin from my vaser ultrasound energy. If I just put that right at the skin and then did ultrasound, it wouldn't be good for the skin. And so we protect the skin with these little ports. They just slide in, and when I'm done, I take them out. That's kind of all that I have to say today about that. Thank you for watching MilfordMD.